My name is Nicole Ruhana. I'm a nurse midwife and a nurse practitioner. I currently serve as an assistant professor in a public university and I supervise graduate nursing students. And I have learned over the last 40 years of my practice that I've always somehow ended up in rural. And it was not ever planned that way. It was just a series of events that kept leading me to one rural place after another. When I was very young, probably at the age of 25, I worked for 2 years in a hospital in Saudi Arabia. And this was in the northern part of Saudi Arabia, about 80 miles south of the Israeli border. I worked for the Ministry of Aviation and Defense, really in the middle of the desert. And for those of you that are nurses, you know that sometimes you get pulled away to another department to work for a shift. So I was working on a pediatric contagious disease ward, and one night had to go to the labor and delivery unit. Signed one labor patient who was a young woman that was part of a nomadic tribe that was traveling through northern Saudi Arabia with her family and her tribe. And she was in active labor for her first baby, and the labor had stalled out. So they stopped at this small rural hospital for care. When I went in the room, I was surprised to see that there was no IV, there was no fetal monitor, there was not any of the normal things that we would see here in the United States for birth. And for me, that was a pinnacle night because I was able to experience normal, unmedicated physiological birth that I would never have the experience to have here in the United States. It was a night shift, and I just remember getting lost in the time. Time was just warped, and I remember that when I was providing care to this laboring woman, I felt like I had come home. And I immediately knew this is what I had to do. There was no other opportunity. There was no other choice. I had to become a nurse midwife. A profound experience for me to experience a different model of care by a midwife, and in a different culture, and with a whole different expectation of what normal family life is or was in that situation. I finished my contract there and immediately came home and did 2 years of labor and delivery nursing, and then I went to nurse midwifery school. So for me, that was a pinnacle moment. It was life-changing for me. It was career-changing. And I just feel, I hope other young nurses have the opportunity to experience something like that really makes them feel like they've come home professionally and can get passionate about their career.